Hi, my name is Carl Pearson, and during my self-imposed quarantine, and this is my 38th video on a variety of topics to help the 99% survive the multiple crises we are now facing. And I now want to explain how 3 Southeastern Asian countries, South Korea, New Zealand, and Thailand, in 1 to 3 months have eliminated the spread of Corona-19 in their respective countries, hoping that we can learn from and follow their successes. I'm an attorney for 58 years. I received my law degree from Harvard Law School. I'm a high school dropout with no diploma, but became president of the university's student body in 1.5 years. I graduated magna cum laude with a BA in 2.5 years, and was offered but turned down a job as the assistant to one of the top real estate developers in New York. And I've been a small business person since my paper route in Nebraska at age 9. I'm almost 84 years old. I live in New York, and I've been cooped up in the heart of the coronavirus for the past 76 days in an all-out effort by me to live many years more. Years ago, I wrote a best-selling book, 60,000 hardcover copies, published by Doubleday, on the stock market and other types of investments. I tell you all this to get you to understand that I have the background and motivation to get to the heart of an important matter, which I'm trying to do in this video, to explain how the coronavirus has already been stopped cold in its tracks, with almost no new cases and deaths in 3 countries and a few others that I didn't even bother to include. With this in mind, I want to also explain about vaccines and cures, another but much longer and unproven way to control the virus, but with many more confirmed cases and deaths which have to be experienced. Vaccines, I'll start first with. The purpose of vaccines is not to cure the disease or virus, but to reduce the likelihood that an inoculated person will become infected by building up antibody immunity in the body. Now, not all diseases have a vaccine. For example, HIV/AIDS, which disease was identified almost 40 years ago in the early 1980s, still has no vaccine in sight. Polio epidemics and pandemics preceded recording history, in other words, are thousands of years old. But in 1955, Dr. Jonas Salk announced the Salk vaccine, and 8 years later, Dr. Albert Sabin saw the distribution of his oral vaccine against polio. The last case of polio in the United States was more than 40 years ago, in 1979, until an outbreak occurred recently among the unvaccinated Amish in several Midwestern states. There are at least 80 companies, universities, and laboratories at work trying to develop a vaccine. The winner, if any at all, with the worldwide market will make several $1 trillion. India, with its 6 companies developing and marketing various vaccines already, has a joint development agreement with the U.S. and is a prime candidate to win this race. But there is the Edward Jenner Institute, located in East Oxford, England, which has a head start and is promising a vaccine by September this year, based on one having proved in previous trials that similar inoculations, including one last year against an earlier coronavirus, were harmless to humans, and 2, new tests show their vaccine to be effective in monkeys. A 6,000 person test is being scheduled for the new vaccine for COVID-19. So that covers vaccines. Now let's talk about cures. Germs are all over the place, and most are not harmful. Germs that are infectious agents are varied and include 5 main types. bacteria, viruses, fungi, protozoans, and helminths. Your immune system gives you protection against many infectious agents, but some germs are constantly mutating in a continuing effort to overcome your immune system's defenses. When you come down with an infectious disease, there may or may not be a cure for it. Bacteria are one-celled organisms seen only by microscope. Bacterial diseases include strep throat, tuberculosis, and urinary tract infections. There are cures for each of these three, but less so for patients that have developed an immunity to the antibiotics or antibacterial drugs that are used to treat them. Viruses are much smaller than cells and are essentially just capsules containing genetic material. Viruses invade cells in a body, reproduce, and stop the cell from working properly, and the cells are often killed as a result. Viruses cause many diseases, including AIDS, common cold, Ebola virus, genital herpes, influenza, measles, chickenpox, and shingles. Antibiotics to control harmful bacteria do not work on viruses. Some infectious viruses have a cure, and some, including COVID-19, do not. Draco, back in 2011, demonstrated that it was a cure for 15 different viruses and won the Time Magazine Award in its category for Best Invention of the Year, and seems to be the most promising cure, yet nobody is financing it in spite of its promising work up to 2011, almost as if the persons who hand out the taxpayers' money are not interested really in finding a cure. About that, please see my last video on this point, video number 37. So, we have reviewed vaccines and cures and see that nothing is now available to stop the pandemic. But there are a few countries that have fully succeeded in doing so without any vaccine or cure. I want you to know about these 3 countries, all of which are in Southeast Asia, and they are New Zealand with a population of 5 million, Thailand with a population of 70 million, and South Korea, population 51 million. First, we'll talk about New Zealand. It has a 1.5% mortality rate against the U.S. 5.9%. From March 1, 2020 to May 26, 2020, that's a 3-month period, New Zealand brought its new cases down to 0. This is described as, quote, the number of confirmed cases is lower than the number of total cases, unquote. So on a chart, it shows 0 for new cases. I provide links in my description for my sources. New Zealand relied mainly on availability of adequate testing kits, PPE, and limited testing to identify the infected persons as quickly as possible and see who transmitted the virus and to whom, and then treat the persons so afflicted. Now in New Zealand, businesses, movies, schools, concerts, sporting events, beaches, malls, churches, and synagogues are open with much less impact because of the immediate, obvious measures, which are sufficient working testing kits and PPE, identification, limited testing, quarantine, and treatment, taken to eradicate the coronavirus. And the obvious job for New Zealand now is to protect itself from visitors through a quarantine and probably a 100% testing regime. The next one is Thailand. It has a slightly higher mortality rate, 1.9%, and that's against the U.S. 5.9%. Since April 27, 2020, Thailand has no or very few new cases, with its chart showing 0 or slightly above, and this is backed by a mortality rate of 1.9%. That's about 1/3 of the U.S. mortality rate. Or if you want to look at it another way, assuming Thailand and the U.S. have the same mortality rate because the U.S. has a lot of cases not identified yet, then the U.S. infections are 3 times 1,800,000, or they would be 5,400,000 and increasing. So if you want to equalize the mortality rate, you do it by tripling the 1,800,000, and realistically that means we have 5,400,000 cases and increasing. So how did Thailand stop the number of new cases? It took a series of orders, never rising to the level of lockdown. When confirmed cases rose to more than 100 per day, densely populated areas were ordered to close public places and businesses, and later there was a national curfew. Initially, the government relied on surveillance and contact tracing, temperature and symptom screening at international airports and at hospitals for travelers or a contact history. Outbreak clusters were investigated, and the public was educated on self-help techniques, for example, hand washing, avoiding crowds and wearing masks when needed, and belated incoming travel restrictions and the requirement of health insurance. The government gave loans and financial assistance, gradually relaxed restrictions since May 3, 2020 to let businesses revive based on having controlled COVID-19. Thailand now has assistant robots and telemedicine to help doctors and nurses for distant care of patients, thereby protecting the medical people. These numerous orders by the equivalent Thailand CDC agency and president, who acted quickly, resulted in ending the number of new cases by May 3, 2020. South Korea, 2.4% mortality rate against the U.S. 5.9%. I've already reported on South Korea's 1-month success in containing the coronavirus with no new cases for a number of days. Then it was reported just recently that 40 new cases had suddenly appeared. This was because of the opening up of the nation's schools at the same time and testing the 2 million incoming students. It can be expected that South Korea will eliminate this pocket of new cases and their sources throughout the nation of almost 40,000 square miles, which amounts to 1,000 square miles per infected student. I'll try to summarize what I've learned. No waiting for a vaccine or cure, which possibly may never come. Fast action by the country's president. Availability of whatever funds were needed without any problems. Availability of working test kits and PPE. A national program to identify infected persons and their sources and subsequent contacts, with appropriate quarantine and medical care to eliminate that line of infection. Little need for financial support of employees, small businesses, renters, or homeowners because of the very short period it took to stop the coronavirus. These countries started when the number of confirmed cases was about 100, that is, at the very start of the pandemic when it first appeared in the country. Now the U.S. has 1,800,000 to 5,400,000 cases, depending upon your view, which precludes a repeat of what worked for the 3 countries, and seems to require testing for all as quickly as possible, and the rest you can probably fill in yourself. I hope this helps you understand what needs to be done to end the pandemic in the U.S. as soon as possible. I'll be back soon with my next video.